As you may already know, some major Medicare changes are on the horizon for 2026, and if you have a Medicare Part D prescription drug plan, this is the year you'll definitely want to pay close attention. The way your out-of-pocket costs work, how much you pay for certain medications, and even how your plan operates, everything is about to shift in ways that could save you hundreds, or even thousands, of dollars. In today's video, we're going to talk about all the new changes coming to Medicare Part D in 2026, what they mean for you, and how to make sure you're getting the best value from your plan during the upcoming enrollment period. So sit back, relax, and let's break it all down clearly, because understanding these updates could make a real difference to your budget next year. Before we dive into the details, let's quickly remember what Medicare Part D actually does. Part D is the part of Medicare that covers prescription drugs. It's offered through private insurance companies approved by Medicare, and you can get it either as a standalone plan if you have original Medicare or as part of a Medicare Advantage plan. Each plan has its own list of covered drugs, called a formulary, and you pay different amounts depending on what tier your medication falls under. Until now, the system has included multiple cost phases, like the deductible phase, the initial coverage period, the coverage gap, also known as the donut hole, and finally the catastrophic coverage phase where Medicare helps you pay most of the costs. For years, seniors have complained that even after reaching catastrophic coverage, out-of-pocket costs can still pile up, especially for those taking high-cost medications. That's where one of the biggest changes of 2026 comes in, a hard cap on out-of-pocket spending. Starting January 1, 2026, no Medicare beneficiary will have to pay more than $2,000 per year for prescription drugs covered by Part D. This is a huge shift, because right now, there's no upper limit to how much you can spend. After you hit catastrophic coverage, you still pay 5% of your drug costs, which can easily add up for expensive medications. But that 5% coinsurance is going away completely in 2026. Once you hit $2,000 in out-of-pocket costs, that's it, you're done paying for the rest of the year. This change is part of the Inflation Reduction Act, which was passed in 2022 and is being rolled out over several years. 2026 is the year many of the biggest reforms officially take effect. And for many people, this $2,000 cap could mean saving thousands of dollars annually. Imagine someone taking a $10,000 a month cancer drug or a medication for a rare condition. Right now, even 5% of that cost can be hundreds every month. But starting in 2026, they'll hit that $2,000 limit, and then everything beyond that is fully covered by their plan. It's a massive relief for those with chronic conditions who rely on costly drugs. Another key improvement is how this $2,000 cap can be paid. Medicare will introduce an option called the Medicare Prescription Payment Plan, also starting in 2025 but expanding fully in 2026. This allows you to spread your out-of-pocket costs over the year in monthly installments, rather than paying all at once when you first fill an expensive prescription. For example, instead of paying $1,000 in January for refills, you could choose to spread those payments over 12 months. It's designed to make budgeting easier, especially for those on fixed incomes. Now, let's talk about how drug manufacturers and insurance plans will share costs under this new system. The 2026 redesign changes how much each party pays once you reach different phases of spending. Previously, after you hit catastrophic coverage, Medicare paid 80% of the costs, your plan paid 15%, and you paid 5%. In 2026, that all changes. Once your spending reaches $2,000, the drug manufacturer will cover 20% of the cost, your plan will pay 60%, and Medicare itself will pay 20%. That means insurance companies and drug makers will take on a bigger share of the cost burden, and you, the enrollee, will finally get a break. Another big milestone coming in 2026 is the implementation of Medicare's first-ever negotiated drug prices. For the first time in history, Medicare will have the authority to directly negotiate prices with pharmaceutical companies for a select list of high-cost, commonly used drugs. The first 10 drugs to be negotiated have already been announced, and the new, lower prices will take effect in 2026. These include medications like Eliquis and Xarelto, blood thinners, Jardiance and Januvia, for diabetes, and several others that millions of Medicare beneficiaries rely on daily. This negotiation power is historic, because for decades, Medicare was legally prohibited from negotiating drug prices. Pharmaceutical companies set the prices, and Medicare had to accept them. But starting in 2026, that rule changes, and the goal is simple: to reduce what both Medicare and beneficiaries pay for the most expensive drugs. This will not only bring down costs for individual seniors but also help stabilize the entire Medicare program financially. However, there are a few things you should keep in mind. First, these negotiated prices will only apply to drugs that are on the official negotiated list, which will expand gradually over the next few years. So, while not every medication will drop in price immediately, it's a big step in the right direction. Second, if your medication isn't part of the negotiation list, you might still see savings indirectly, because insurance plans may adjust their formularies and negotiate better deals with manufacturers themselves. It's also important to know that drug companies will now face penalties if their prices rise faster than inflation. This rule actually began in 2023 but will continue through 2026 and beyond. What that means is if a pharmaceutical company tries to hike the price of a drug beyond the inflation rate, they'll have to pay Medicare a rebate, effectively discouraging unfair price increases. So, for you, the consumer, that translates into slower price growth and more predictable drug costs each year. Now let's talk about premiums, because many people worry that with all these new protections, premiums for Part D might go up. The good news is that the government is implementing measures to stabilize premiums through at least 2029. CMS, the Centers for Medicare and Medicaid Services, has introduced what's called the Premium Stabilization Demonstration, which limits how much premiums can rise even as plans adjust to the new cost-sharing rules. In short, while some plans may see modest changes, experts expect that average Part D premiums will remain fairly stable in 2026. Another improvement coming is more transparency and simplicity in how plans display their drug coverage and pricing tools. Starting in 2026, plans will be required to provide real-time price comparison tools, so when your doctor prescribes a medication, you can instantly see what it will cost under your specific plan and whether a lower-cost alternative is available. This will help beneficiaries make smarter choices and avoid unexpected pharmacy bills. Let's look at what all this means for you during the annual enrollment period, which runs from October 15th to December 7th every year. When 2026 plans become available, you'll want to carefully review your current Part D plan, because the new cost-sharing rules could change which plan is best for your situation. Some plans might reduce premiums, others might adjust formularies, and a few might merge or discontinue entirely as the market adapts to the new rules. If you take expensive brand-name drugs, make sure you check whether those medications are affected by the new negotiated pricing or whether your plan includes them in its formulary at a reasonable tier. Also, look at how your plan handles the new $2,000 cap. All plans must honor it, but how they structure monthly payment options could differ. Some may make it easy to enroll in the payment program online, others might require you to call customer service. It's worth checking those details early. For people with low incomes who qualify for the Extra Help program, there's even better news. The Inflation Reduction Act expanded Extra Help eligibility starting in 2024, and by 2026, more beneficiaries than ever will qualify for full assistance. This means lower premiums, lower co-pays, and no deductible at all for many people who previously only got partial help. If your income is limited, make sure to apply, because these savings can be significant. Looking ahead, the long-term impact of these changes could reshape how Medicare works for future generations. Experts predict that the $2,000 cap and negotiated prices will encourage more people to stay adherent to their medications, meaning fewer skipped doses, better health outcomes, and potentially fewer hospitalizations. That's good not just for individuals but for the Medicare system overall. But it's not all smooth sailing. There will be an adjustment period. Insurance companies are redesigning their Part D plans to fit the new model, which might mean formulary changes, network shifts, or different cost structures. Some beneficiaries may notice that their plan's premium or deductible changes slightly, or that certain drugs move between tiers. That's why reviewing your plan during AEP is so critical. Don't assume your 2025 plan will look the same in 2026. As always, Medicare.gov remains your best tool for comparing plans side by side. You can use the Plan Finder tool to enter your medications, zip code, and preferred pharmacy, and see which plan gives you the lowest total annual cost. And if you want personalized help, reach out to your local SHIP office. That's the State Health Insurance Assistance Program, where trained counselors can walk you through your options for free. When we talk about lowering prescription drug costs, we're really talking about helping people live better lives. For many seniors, the burden of medication costs isn't just financial, it's emotional. Having to choose between paying for prescriptions or groceries is a heartbreaking reality for too many people. With these 2026 changes, Medicare is taking a huge step toward ending that dilemma. Capping costs, negotiating fair prices, and holding drug companies accountable are all moves designed to make the system more sustainable and humane. And that's the real story behind these numbers. This isn't just policy, it's people. People who can finally afford their insulin. People who can stay on life-saving heart medication all year without fear of running out of money. People who can live with less stress and more dignity. So as we wrap up, let's recap the key takeaways. Starting in 2026, no Medicare Part D enrollee will pay more than $2,000 out of pocket in a year. The 5% catastrophic coinsurance is gone. Drug manufacturers and insurers will shoulder more of the cost. Medicare will begin using its new power to negotiate prices on select drugs. Premiums will be stabilized, inflation-based penalties will keep drug prices in check, and new payment and transparency tools will make it easier than ever to manage your coverage. The bottom line, 2026 is shaping up to be one of the most important years in Medicare history, especially for those who rely on prescription medications. So don't wait until the last minute, review your plan options, learn what's changing, and be ready to take advantage of these new benefits when the enrollment period opens. If you found this video helpful, don't forget to like, share, and subscribe, because we'll be covering every new update as Medicare releases more information about 2026 plans. And if you have questions, drop them in the comments. We're here to help you make sense of it all, step by step. Remember, knowledge is power, and when it comes to Medicare, it can also mean saving money and protecting your health. Thanks for watching, and see you in the next video.